This morning, we are continuing the conversation about children and accidental overdose deaths. This after we learned yesterday about a new study that revealed opioids like fentanyl accounted for more than 50% of deaths among children involving substances. According to a new study published in the journal Pediatrics, 731 children 5 years old and under died between 2005 and 2018 for poison-related issues, and the highest number of deaths were from opioids. And it's happened here, too. Jacksonville police say a 20-month-old baby died last December from an accidental fentanyl overdose. These two people have been arrested as a result. And a French couple is suing Airbnb after their 19-month-old died, also of an overdose, when they rented a home in South Florida. The lawsuit says that fentanyl was present in the home during a party held by previous renters. Airbnb is now accused of failing to adequately clean the home. What a tragedy. Now, Susan Pittman is founder of Drug Free Duval and is joining us via Zoom this morning. Good morning. Thanks for being with us.
Thank you for having us, Jen.
Susan, first, your reaction to this new data about young children dying of overdoses?
It's just tragic. And I think that seeing it quantified as this study did really brought it home that the risk is real. And it's not just real for people intentionally seeking any drug use. It's actually our most vulnerable, our precious little ones. So that Airbnb case is really frightening because the idea is it's most likely that child was exposed like in residual fentanyl in a rug or on a surface somewhere, and it wasn't. There's no probably even direct ingesting. You know, sometimes when children are exposed, it's in a bottle or it's somehow on a pacifier or something. But in this case, it's really kind of another step away. This is really a risk for our babies.
Yeah, I think it's interesting, as you pointed out. Also, we've talked previously, about a case where there was a police officer who'd pulled someone over down in Tavares. And just through an interaction that she had with the driver, somehow became exposed to fentanyl and OD'd on it. And thankfully, her partners were able to get there and administered Narcan a couple of times, and that saved her life. I want to talk a little bit. You were able to provide and really dig deeper into some local numbers here in Duval County involving overdoses of children who are 5 and under. And it's interesting because while fentanyl necessarily is not mentioned here, this is the most recent study, which was 2018. I mean, these medications, which right now, Susan, we're showing to our viewers on the screen, I mean, you can, all of them really treated for severe pain. You know, somebody who's maybe had surgery and comes home with this. I mean, could you explain to our viewers the importance of just safe storage?
Absolutely. Thank you so much for asking. And, you know, one of the big things is that we say a grandparent can accidentally, and I'm a grandmother, I have 3 precious little ones, and a grandparent can accidentally become the drug dealer. If I have medications that I've been prescribed and they're in my purse, and I go to visit my kids or my grandkids and I leave my purse on the floor, just simple actions like thinking through, hanging that purse up somewhere or putting it in another room and shutting the door, that kind of thing. Certainly within our home, safe storage. We recommend, there are lots of cool things around like lock boxes and lock bags, but that's expensive and, you know, that kind of thing. Y'all just put them way up high in your kitchen somewhere public, not in your bathroom. People go into bathrooms alone. So if it's somewhere public, but really high up, difficult to access. If I walked into my kitchen and saw somebody standing on my sink, you know, reaching up to this super high cabinet, I would go, whoa, what are you doing? And maybe help prevent an overdose, either an accidental or a purposeful overdose. So safe storage is critical. We're in this together, you know, all of us, and it's a way that we can really create a culture of safety in our homes.
And I also want to, as our kids get older, you know, I mean, sometimes we're really good about teaching our young kids about things they should and shouldn't do or shouldn't consume, as an example. But as our teens get older, there's a tendency that we make these assumptions that they remember what we told them years earlier. Would you explain also the importance of having that conversation? Because sometimes I think parents might send a mixed message to their kids inadvertently about children at a young age and pill sharing.
You know, I have shared my bad mom stories. And as a mom of 4 children, there were times where I would share a prescribed medication, a cough med or an antibiotic or something like that, because after second and third child had gotten this thing, I was tired of going. I was tired of paying the copay. I didn't want to expose my other children to more sickness if I went to the pediatrician's office and stuff. But what I didn't realize later is that I was actually helping them believe, like reduce their perception of harm around sharing drugs. And so what we really try to help our teens and families understand is you can start when they're real young and you get prescribed a drug and say, look, Katie, this has your name on it and it's only for you, and create an educational process that begins really young and really positively about how special this drug is, and the doctor prescribed it just for you for this illness. Then it's less likely that your kids will have that reduced perception of harm, because later when they're in high school or college and a friend says, oh, I've got a medication that can help you, here you go, they might go, no, that doesn't have my name on it. So we're really trying to encourage people to only use medications from a pharmacy, a legitimate pharmacy that has their name on it, which is actually both the law and the better health choice.
And so important, because as we have seen now over the last couple of years, the reality is that a lot of kids sadly are buying medications, through Snapchat, and they don't realize that 60% of those medications are very likely laced with fentanyl, which can kill them. Susan, thank you for your time this morning. We appreciate it.
Thank you, Jennifer. You are doing great work.
So, we appreciate your help in spreading such an important message. And we want to remind our viewers there is a fantastic and fun event that's coming up to teach local teenagers more about drug abuse and just living a healthier lifestyle. There is a teen summit hosted by Drug Free Duval through its teen component, which is called Duval CoLab. It's coming up later this month. It's free for your teens. It's all teens who are there from all over Duval County, and the kids will also receive volunteer hours for attending. It's Sunday, March 16th from 1 until 4 in the afternoon at the Dolores Bar and Wayne Weaver Community Center near downtown Jacksonville. For more information, you can search Duval CoLab on Instagram.